guys, welcome back to Medical Coding with Blue. Today's episode is all about the CPT Professional Edition by the AMA. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so I'm going to be continuing on with my book review process that I've been doing. I did one for ICD-10 CM. Now I'm doing it for CPT, the Current Procedural Terminology Professional Edition by the AMA. This is the book for all of the outpatient encounters, and this also has the evaluation and management and modifiers in it, okay? So we're going to go ahead and go over this. This is the book that we all have to use if you're taking a medical coding certification exam, whether you're sitting for an American Health Information Management Association exam, the CCS, the CCA, or the CCSP, or if you are sitting for an AAPC exam, the CPC, this is the book that you do need, okay? So opening it up to the first page, you will see that we have a whole inside cover, and it has all of the modifiers listed. This is a quick reference, and it's great to kind of review. You do not have to memorize these, but you do have to know where to find your answers, okay? So the inside flap is the easiest place to find it. And then I will go over the appendix in the back that goes into more of the discussion and the explanation of what these modifiers are about, okay? If you notice, I have not used my my tabs. If you are taking an exam with a HEMA, you can use these tabs to tab this book with. However, I strongly do not recommend it. You see, my book is clean, and the reason that my book is clean is because if you are using the book like you're supposed to, you will not need these silly tabs. I do not believe in tabs. I believe that anybody who uses tabs, it is hindering your ability to learn. You can disagree with me all you want to, but my goal is for my channel is to help y'all to become strong medical coders, and I do not believe that you can do that if you are using these training wheels that you do not need. And these tabs here are training wheels. It is a waste of your time because I have heard people say that it has taken them up to 8 hours to tab their books and get all the highlighting and writing and stuff that they want done in it. And that's 8 hours you could have been spending actually looking up codes and studying and practicing with your CPT book. Okay, so I do not believe that there's any good or valid reason for writing at all or tabbing or circling in these books. I mean, everybody has their own way of doing things, and you may say, well, Blue, that's just how I learn. This is not a workbook. This is a reference book, okay? Let me make that very clear. There are workbooks that I do recommend, and you are more than willing, more than able to go ahead and write in those all you want to. But when it comes to these, if you are taking an HEMA exam and they see that you have excessive writing in your CPT book, they can stop you from taking your exam. So that's what I want to tell you all, to not write in your book. Don't tab, don't highlight, don't do any of those things, because a HEMA does not allow for homemade tabs either, okay, just so we all know and understand, all right? And these books will get inspected when you go to the Pearson VUE Testing Center, okay? So with that said, we have our place of service codes for professional claims, and that is really the first page here, front and back, and we've got CPT 2025. So here's our table of contents, and then it's got a lot of just details about the book. It's got a lot of just other things that you should know. It's got the illustrated anatomical and procedural review. It's got some prefixes, suffixes, and root words here that are common. And so it's got those broken down by numbers, surgical procedures, conditions. So there's a lot of really helpful information. If you're looking in the book, you'll be able to see that. And this is all the pages that have procedure illustrations on them, okay? So then we're going to get here to the evaluation and management. Now, I know I heard some people just now start groaning about evaluation and management. But here's the thing. When it comes to evaluation and management, people make evaluation and management out to be a lot harder than it actually is. if you are reading and taking the time to read the guidelines, the Evaluation and Management Services guidelines, they are right here, literally right here. They give you coding tips throughout this book, but even more so that it's more important that you all understand, you have to read this. And it's not very long. You have to read it. Is it going to make sense to you right away? Absolutely not. Absolutely not. But the person that is going into this head on with really trying to read it and understand it and look at all these elements of medical decision making, looking at them and understanding what they mean, you are going to be able to be a lot better off because of it. Now, if you see, there's some examples here. These are not all inclusive examples, but they are some examples. And if you see here, you don't see any examples here. You don't see any examples for straightforward as well. But you can always Google those. You can always Google them. And so that way you can kind of get an idea of what that means. What does a low risk mean, right, for complications? And so that's what you want to look up. And you will see things like over-the-counter medications or sprain treatments and that kind of thing. Those are some examples of low, right? And so when we're thinking about our table of risk, we are thinking about what is going to impact this patient so much that the provider has to use more of their cognitive resources in order to decide what level they belong in. Okay, so that's something that you can review here. And it's giving you more information about what each one of these things means and some examples and stuff. So it's going to help you if you take the time to read this, okay? And then evaluation and management is actually a very small section of CPT. Let me see if I can get all of it right here. See, these are all of the CPT section is all in red right here, and it's not that much. So this, you can, in actuality, just sit here and just read this, okay? You can look at the description of the evaluation and management code. It's going to start here with the new patient codes, 99202, 99203. Here's the coding tip for all of that, the professional services, and what does it all mean? And then it's going to go here. It's going to continue on. It goes up to 99205 for new patients. And then for an established patient, it's going to start off with 99211, but you need to make sure that you read this because this is really more for the nurse and not for the provider, okay? And then it starts 99212, 213, 214, 215. And so then it's going to give you more information about telemedicine and that kind of thing. So here is where you're going to really spend some time to just read, guys. Sometimes that's what you need to do, and especially when it comes to evaluation and management, because people get unnecessarily scared of evaluation and management because somebody else scared them, because somebody else told them that it was difficult, because somebody else said that it was hard, and that kind of thing. But here, if you're looking at it, you'll see emergency department services, new or established. There is no such thing as a new or established patient in the emergency department because you're seeing the emergency room doctors because it's an emergency. And so they don't have that sort of other rule of if the patient has been seen within the last 3 years and this is an established patient. If they haven't been seen within the last 3 years, then this is a new patient. The ER doesn't have that, okay? So that's what it's explaining there. But you would know this by reading this, okay? And then it gives you all the codes, 99281 to 99285. And these are all your emergency department codes. It tells you here, let me see if I can creep up a little bit. Can I creep up? Creepy. Okay. It tells you here, it describes to you what it is. Emergency department visit 99281 for the evaluation and management of a patient that may not require the presence of a physician or qualified healthcare professional, right? And then there's 99282, which is emergency department visit for the evaluation and management of a patient, which requires medically appropriate history and or examination and straightforward medical decision making. So again, when we go back and we look at the table of risk and we're looking at, how do we get there? Using that table of risk. And again, you can totally download different ones from the internet that's going to give you a little bit more detail to kind of help you. But here we have high, and we have moderate, and we have low, and we have straightforward. And you're looking for 2 out of the 3 boxes to line up. And so it's a lot more than I can go into on this video, but that's what they're talking about. What is your level of risk, okay? And so if you're reading that level, it'll tell you what it's looking for. This one is what is this? Straightforward, and then it goes up every level. This one is for low medical decision making. This one is for moderate medical decision making, and this one is for high. So there's going to be different levels of evaluation and management, because sometimes the patients are going to be a little bit more needing different levels of care, as far as like, this patient's at a higher risk because they are elderly, or this patient is at higher risk because they are pediatric. This patient is higher risk because they have more conditions that can affect the provider's ability to be able to treat them, okay? But one thing I did want to mention, I know this is about CPT, but let me get you guys something that will help you to learn evaluation and management. This book is from Optum. This is not an ad for Optum because they don't pay me to talk highly of them. But what I will say is this is an awesome book because it is a workbook. And you can go through this book and work through it from cover to cover. And it will cover every single evaluation and management level there is. And it will explain things very straightforwardly. I love this book. And it's going to give you tests throughout. And this is a wonderful book to learn from. When I was in medical coding school, I learned from a book about evaluation and management. It was not this one, but it was the book that they had out at the time. No, I'm not going to give you guys the title because that book is long gone out of date, okay? There was a lot of things back then. This is, of course, the 2023. I'm not telling you to get the 2023. Please don't. Get the most recent on this one, 2025, okay? Get that one from Optum and use it, study it, go from cover to cover and work through every single chapter here. So that way you can learn evaluation and management while you're learning CPT. And while you're doing that, guys, the thing that I have to say is this. There's too many of you that are relying on other people to tell you what to do, as far as like other students. And they're already lost and confused. And then maybe somebody had a bad experience with a teacher. And so now they're saying bad things about medical coding. And so there's a lot of that going on too. So it turns into like, okay, well, I don't know what I'm doing and I don't know what I'm doing. So then we're going to lead each other not knowing what we're doing. And so thinking that you do and you don't, okay? But what I am saying is this. When you take the time to actually look at the book, get books like this to help you, the Evaluation and Management Coding Advisor. Again, if you say, well, Blue, I don't have the money to buy this book, that's okay. Go to the public library and see if they have it. See if they have this book, okay? Go on eBay, go on abebooks.com and see if they have it for a cheaper price. If you need to get an older book, just know that evaluation and management has changed. That's why I'm strongly recommending that you get the 2025 editions, okay? But the thing about it is this book is going to help you if you use it and you work through it cover to cover, okay? And so that's what I would recommend if you are getting stuck on learning evaluation and management, because as I said, it is not difficult. For those people that says, oh, it's so scary. And a lot of times people are just repeating what they've heard from somebody else. So they hear somebody else say that it's scary, then they get scared, and then they perpetuate that fear to others. This is why I tell you all to stop telling other people about what you're doing when you're trying to learn this. Because you will run into a lot of people who will speak like they know and they have no idea. They have no idea at all. And whereas I will tell you, this is what you have to do. And I will tell you the things that you don't want to hear, which is you have to spend 20 hours per week studying this stuff and looking at these pages and going through these books, so that way you can understand and you can be more confident when you're going out there. You know, I get these messages all the time from people who says, Blue, how can I be more confident? How many hours per week are you studying? Well, right now I can only fit in 4 hours because I've got kids and a full-time job. Well, I've had other people who write to me and say that they have a full-time job and they've got kids and they are doing this and they are making those 20 hours per week. And then I get messages from other people who say, Blue, I did what you said. I studied 20 hours per week and I passed my certification and I'm going to get my first job. And they get their first job because they're competent. That's how you get your first job, is by being competent. Even though they say, oh yes, we want 3 to 5 years, they're always going to say that because employers are lazy and don't want to have to train anybody. But it doesn't mean that you can't come in with knowledge. And how do you get that knowledge? By looking at your book, by studying for 20 hours per week, okay? And so this book is set up opposite of the ICD-10-CM, because ICD-10-CM, the index was in the front. In CPT, the index is in the back, okay? So back here is all the procedures that we need to look up, okay? All the procedures to look up and everything is right here in the back. But you can, for evaluation and management, you can go to that chapter and look those up there in the front, okay? But for like all the other procedures you're looking up, like angioplasty, okay, that's where you would find the code range to go to, okay? Or the code specifically to go to. You are not ever going to code directly from the index. You never code directly from the index. You always take what you see here in the index and you flip to that chapter so that way you can find that code. And you may see that there's another code that may fit better. Or you may see that there's something else that you need to add on, okay? Because sometimes there's the parent code and then there's add-on codes, okay? Add-on codes are if the procedure is a little bit more expanded and there's something else that they're needing you to add on, should that apply to that procedure, okay? But you always start in the index and then you go to the tabular section, okay? So here is the anesthesia. Again, this is a very small chapter for anesthesia. And the guidelines are right here in the front. Okay, for anesthesia, there's the anesthesia modifiers, and there's your little add-on codes. There's the key at the bottom that'll tell you, what these little symbols mean and stuff. And you'll see them right next to it. Like you see that little plus sign, that means that's an add-on code. So that's good. There's a parent code that's going to go with this add-on code, if you will. But yes, so there's your modifiers there. All of your anesthesia codes. And people will, this is the most, the chapter that I get talked to about the most is anesthesia. Why? I don't know. It's very small, and I think it's very direct and straightforward, but for some reason people have a hard time understanding it. So I would recommend going through that. Here's your surgical guidelines, because the rest of this starts your surgeries, okay? Your surgical guidelines. What constitutes your surgical guidelines and what is considered as part of those materials, right? What's considered in the CPT surgical package definition is all right here. There's also the Medicare Learning Network. You can Google that. There's a global surgical booklet that you can Google from the Medicare Learning Network. So you can Google Medicare Learning Network Global Surgical Booklet. It's about 21 pages or so PDF, and you can download that. It'll explain everything about the global package, because some of these procedures in here have what is called a global package on them. And it means that there's a 0-day, 10-day, and a 90-day global period, right? So 0-day means that everything is included on that same day. So if a provider is performing a minor procedure like a arthrocentesis, which is an injection, for example, an injection into a joint for like a pain relief, right? That has a 0-day global period on it. That means that if the provider is seeing the patient for that particular procedure only on that day, or he decides to do that procedure that day for that patient, that is the only procedure code that he can get. He cannot get an evaluation and management in conjunction with that procedure because it's already included in that global package. And you can find that out by looking at the global surgical booklet from the Medicare Learning Network, okay? And that's the guidelines. And just because they say, oh no, we don't take Medicare, it applies, okay? Because all of these insurance companies model themselves after Medicare. You know, Medicare is responsible for hanging on to the Medicare trust fund and being very frugal with it. And because of that, they're going to be the most conservative when it comes to these procedures. And that's one of the things that you should know. Because people try to say, well, no, I decided to do this today, and this is just an injection, but I'm still going to get my new patient E&M. No, you're not, because it's already included. Whether the patient is brand new or an established patient, if that is the only thing they are seeing that patient for that day, that 0-day global procedure, that is all they are going to get. Now, if they're seeing there for something separate, then that's something different, okay? But that's what you're going to know when you read something like the Global Surgical Booklet from the Medicare Learning Network, when you're seeing this here, okay, so that you can understand what all is included in this, okay? And so then we're going to start off with the integumentary system, and this is the code range for the integumentary system here, and these are all the procedures that can be done for the integumentary system. So let's just say that you are working in a dermatology clinic. You're going to want to look at this specific chapter, okay, so that you can make sure that you understand all the things that are covered here, because throughout the book, it's going to give you these little passages here to read. It's going to give you some definitions here. It's going to give you some coding tips throughout the book. And so there's all these little symbols here. You know, that's an add-on code. That's an add-on code. That's a main code right here. This is an add-on code here, because this is the main code, because it says 15260 is a full thickness graft free, right? Including direct closure of donor site, nose, ears, eyelids, and or lips, 20 square centimeters or less. And then it says here, this is an add-on code. So if this was greater than 20 centimeters, and let's just say with each additional 20 square centimeters, let's say it was 40 square centimeters total. So you would report this code, the 15260, and then you would also report the 15261 code as well, because 20 plus 20 is 40, okay? So if it's 40 square centimeters total, you would report both of these, okay? So that's just something that you ought to know. And then it says, there's other little notes here too. It says, use 15261 in conjunction with 15260. So it's telling you that this code is part of this code, okay? So long as it meets, right? So like I said, 40 square centimeters, this is 20, and this is the other 20. So that's 40 altogether. So you report these two. And then it says for eyelids, see also, and then it'll direct you here to go to a different code range, right? And for repair of donor site requiring skin graft or local flaps is considered a separate procedure. So you know that if that happened, then you know you're going to report it separately. Okay, so there's also an additional book that can help explain some of these procedures and like what all is included. I'm going to have to do that on a separate video because I swear I just blinked and now I'm already at 24 minutes. So I got to hurry up. Okay, so, but again, this is what you're going to be looking at, okay? So take the time to review each and every single chapter. You don't have to read everything, but at least know where you can find some of these tips and some of these things to kind of help you, okay? So that's that's just what you have to know, right? Mohs micrographic surgery. Okay, this used to be my nightmare, but once I spent the time with it, then I was able to figure it out, and so will you. But it's going to take practice. So here's the musculoskeletal section, right? The 20,000 series. Here we go with the anatomy plates in it as well. And here we've got more wonderful illustrations. We've got the musculoskeletal system, and it's giving you all of this information here. So I really recommend that you read these things in between here if you really want to get good and competent about what you're doing. Because a lot of times, especially when there's new coders that come in, sometimes you're coming into a place where there's nobody that's certified but you. And so you're going to be looked at as the subject matter expert. So it is going to be imperative. It is going to be on you to make sure that you understand these things. And it's going to take time, guys. It's not going to happen overnight. You know, some of you expect to learn this right away. You want to learn the shortcuts. What do I have to know? You've got to know everything, but it's just going to take some time. So right now is a great time to get that broad stroke knowledge of where things are in this book, okay? So that's what you have to do when you're reviewing the musculoskeletal section. Look at that. And it's got more wonderful procedures illustrated here, okay? So, and then it's going to go on to respiratory. So if you work in the pulmonary clinic, this is where you want to look at, okay? And there's all of these, again, more tips, more guidance. And so that way you can look at those things. It talks about here when things are out of order and where to go, what code range to look in to find those that are out of order. So that's just something else that you got to know, okay? So in the interest of time, I'm going to go ahead and speed this up so we can get to the back. But yes, I do recommend going through at least a chapter at a time so that way you can get familiar with all of these procedures, and that way you know where to kind of look and where to go. Because it's the person that is well versed with this book that is going to be successful with this book. Okay. Appendix A was what I was talking about earlier. It's got all of the modifiers listed here, and then it's got an explanation for them here. So if you're ever confused or you don't know where, this is a great read. Okay. And it talks about CPT level 1 modifiers, okay? And where do those apply? Category 2 modifiers, and then level 2 HCPCS modifiers are right here as well. Appendix B is for the summary of additions, deletions, and revisions. Again, it's in the back of the book versus in ICD-10-CM where it's in the front of the book. So this is a great thing. If you are curious, something happened with a denial or something, you can look back here and see, did we just report an old code and we need to report a new code? You know, that's something that you can find there, reference. They used to have clinical examples and they took them out. I don't like that. I wish they would bring them back. But here's a summary of all these add-on codes. Remember, add-on codes cannot be listed first, okay? There's got to be something else that's listed first. So sometimes, again, if something's getting denied, maybe it's something here, you know, so you can look there to see if that's the case, okay? And then, you know, we need to do a little bit of education so that doesn't happen again, right? Appendix E is for a summary of CPT codes exempt from modifier 51, okay? And then exempt from modifier 63, right? And then so we have more of those, just different things. I really wouldn't pay attention to any of this because that doesn't really have anything there. But Appendix J, they have that there. And Appendix L, the vascular families. And again, this is something that you can, if you're working in any of this type of stuff like cardio and things like that, you want to look at these things so that way you can be familiar, okay? Anything having to do with the vascular families is going to be right here. Not just cardio, but it's everything, okay? See? They have the abdomen, they have the thorax. So all of this here, just your vascular system is all covered here. Appendix M is your renumbered CPT codes, the citations crosswalk, where you can find it and stuff like that, okay? Yeah. And then Oh no, that's the deleted. My bad. That's the deleted ones. So then we have, oh, here it is. Never mind. So this is the summary of the resequenced codes. So where the code is and where it's which range to look in order to find it. Okay. I'm trying to hurry. That's why I'm talking fast. But yes, so that's what you want to look at when you're looking back here. Okay. And then of course we have our index, and this is where you're going to look for all your procedures. Okay. And again, taking the time to just kind of peruse the entries so that way you can kind of look and see what to do when you're looking up a certain procedure code. You'll know where to go. And then we have our common abbreviations, and this is another, it's just on the back flap here. And this is a really great thing to look at if you are looking at the documentation and they're using an abbreviation and you don't know what it is. This is a great place to reference and look and see, if it's here, what it is. Although they should really refrain from using abbreviations as much as possible, but what are you going to do? So anyway, that is my review of the CPT 2025 AMA Professional Edition. Look at it, get familiar with it. It is for your benefit, coders, okay, and future coders. It is for your benefit. And I have to ask again if you like this type of video, because these types of videos, for some reason, people don't watch these. So if you like this type of content, make sure that you hit that like button. No one else but me will know that you hit that like button. And comment, in the comments below if you want to see more of this content. Let me know. Comment there. All right, guys. So if this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.